My name is Camila Boynton, and I would currently describe myself as a public health data analyst, although I've also been called a public health informatician. And before that, I actually did program management. So it really depends on what job I'm doing at the time, but right now, that's how I would describe myself. Huh? So, a little bit about my educational background. I did my undergraduate in anthropology, specifically archaeology. Now, anthropology and public health actually share a lot of similar topics. And so, after I finished working in archaeology, I decided I wanted to pivot and I wanted to work more in the medical sector. And so, public health gave me the opportunity to use the skills that I had previously learned as an archaeologist and apply them to the medical field. As far as my career journey, it's a little bit unconventional compared to maybe some of the other people that you're seeing on here, or maybe some of the people that you've networked with. So I grew up going to school overseas. When it was time to go to college, I went to a really, really small school in Florida. And like I said, I studied anthropology and archaeology. After that, I tried to work in that field. But because I was working internationally, there was a couple protests and revolutions, and I ended up back in the US. And at that point is when I started working as a teacher. And I did that for about a year before I moved overseas, and I lived in Turkey working as an English tutor there before I decided, all right, it's time to come back to the US and get a master's degree. And that master's degree that I selected ended up being public health. So that's a little bit of my educational trajectory. As far as my career trajectory, I always thought that I wanted to work with NGOs. But after going to school, I found out that I also liked working with the federal government, usually the US federal government. So I've actually ended up working in a couple different sectors. I have done public health in the federal government, I've done it at the state level, and I've also worked with NGOs, both internationally and domestically. Let's see what else is here. What I currently do, as I said, I'm a data analyst. And so usually I'm working with different, like I said, federal departments or state departments. And usually they have some sort of technical project, data science project, that maybe they have a boss who knows how to do it, but that boss doesn't have time for it. So I get brought in to work on these very specific projects, which could be data cleaning, but it could also be redesigning a workflow so that best practices in data science are incorporated. So it really depends on the company or the organization and what their current objectives are. So my job is very dynamic. I can go from working in the field one day to working behind a computer the next day. So it really depends on the subject matter that I'm working on. The purpose of my work, other than making me money, mostly what we're seeing in the field right now is you have leaders who want to make data driven decisions. So basically, when they have to make a decision, they want to look at the available data so that they can make an educated decision or an educated guess on what's going to be an impactful way to use the available resources of that company or that organization. And so I might get brought in to analyze a data set to show leadership where they're using their resources. Or if, let's say, for example, if we want to deploy people to an outbreak, whether it be an Ebola outbreak, a COVID outbreak, a hantavirus outbreak, they might need to know which one of their employees is actually ready to deploy. All of that is using data that's available to that organization or to that, the federal government, the state government. We're looking at the data that they have available, either programmatic or operational data, and we're making decisions based on that. So in this case, it's who is ready and has all the required trainings in order to go on a deployment. You don't want to make that a random guess. I think so and so has all the required paperwork, and all the trainings in order to go on a deployment to, I don't know, DRC in Central Africa. You don't want to make an assumption. You would rather have correct information, so you send the correct person for the job at hand. The who do I work with and what problems am I trying to solve? A lot of times it's operational problems, as I just mentioned. So who gets deployed where? Who has the skills to work on a particular project? Sometimes I may be working on quality assurance. Let's say we have a lab and they need to make sure that they're hitting certain key performance indicators, but they don't have the time to go through that data, clean it, and report it. So sometimes that's the type of work that I'm doing. And I could be working with laboratorians. I could be working with fellows in specific sectors, whether it be data science, general public health, program management, whatever it may be. So the range of clients that I have really runs the gamut. I could be doing infectious disease one day, laboratory work the other day, and operational work the next. It really depends on the team, what they need, and what kind of teammate they want. I would say that I am not the most conventional person. So if you're looking for conventional output, I'm not the person for you. I'm more about innovation, looking at all problems in new ways and seeing if we can use the existing tools that we have at our disposal to solve those problems. As I mentioned, what problems am I trying to solve? It could be operational. Who is ready to deploy? It could be quality assurance, right? Is the product that we're making, is it hitting the KPIs that we want to be hitting? It could be epidemiological, right? So risk ratios, attack ratio, whatever it may be. It really, like I said, it depends on the team and what they're looking to get done. For the most part, I am not working with epidemiological data because you have epi specialists to do that. Not that I couldn't do it, it's just that I'm better suited for operations or maybe tracking something, personnel management. Those are the things that don't have clear, let's say, boundaries and constraints the way epi does. And so the tools available for program manager may not be as sophisticated as what's available to an epi person. That being said, I believe everybody uses data in their work. It's just everybody doesn't know how to clean, transform, and analyze it so that they can get real actionable insight from it. Furthermore, I don't think everybody knows how to use some very, very, very easy technologies. So I'm usually working in things like Power BI or Tableau or even just Excel. Those are tools that are not used to their full potential, even though they're relatively easy to learn. For the most part, what I've seen is that people are just really busy putting out fires, as we say in public health. So they just don't have the time to sit down and create a dashboard or create a framework that will help them use their data from one project to another. Let's talk about my typical day. So if currently I'm unemployed and I'm actually working on building my own business, my own data science business. And so if I'm doing work for myself, the typical day will look like taking on a student early in the day for about 2 hours. So we'll go over whatever data science project that they're working on at the time. I have some students that are learning SQL. I have some students that are learning Excel. And I have some students that are at the very, very beginning of data science learning. So they're doing more like the fundamentals. So in the morning, I'll, answer emails, teach a class. And then for a couple hours after I teach the class, I'll do follow-up work. So any homework that person needs to be doing, that student needs to be doing, as well as other students. So I'll do that for about another hour or two. Then I'll teach myself something. The earlier in the day that I can teach myself something, the better, as my brain is just usually more awake in the morning for processing new material. If I'm doing something where I very much understand the material, I'll save that until later on in the day where maybe I don't need to use as much cognitive resources to put my output out there, right? So answering an email is not very hard. I'm not going to do that first thing in the morning. I might look through my emails, but I'm not going to answer them first thing in the morning. So I try to chunk my schedule with blocks of time where I'm doing usual things. And from 10 to about 2 in the afternoon, I try to keep that block of time for the harder things that I have to do, the things that require a little bit more of cognitive work. Um, Let me see. What other questions do we have on here? That's if, I'm sorry, so that's my day if I'm teaching. If I were employed, then the way I would usually schedule my day is still actually the same. So if I'm starting at 8 or 9 o'clock in the morning, I would look through my emails and make sure there's nothing urgent. If there is something urgent, like maybe one of my clients needs me to update a dashboard, that's fine. I'd rather hear about it first thing in the morning than to go into like a 2 hour, 3 hour analysis binge and miss an email from somebody, especially if the client just wants something very easy to be fixed. I can do it in 5 minutes. I'd rather do it quickly and have it for them, an updated dashboard for them to work on throughout the day. And then what I would do again from about 10 to 2, I would block that out to do the more intensive work that I had to get done. So if I had to do some meetings that were going to be very hard for me to get through, maybe because, the person was going to need a lot of explanations and I was going to have to code switch a lot, I would rather do that earlier in the morning. In general, I would like to get my meetings done earlier in the morning so then I can spend the rest of the day getting the things done that I need to get done without too much interruption. It doesn't always work out that way, obviously, because sometimes you have to meet with your boss, and a lot of times your boss may not be available to meet until 3 or 4 o'clock in the evening or in the afternoon. So again, depending on what job I'm doing for that day, my schedule may look a little bit different. But overall, I try to keep 10 o'clock to 2 o'clock as my more intensive time. Anything outside of that, I'm usually doing documentation or answering emails or something where I can be a little bit more tired to do it. What else do we have here? The skills that I use regularly, I have to say I use a lot of my biostats and epi skills, but not in the way that I thought I would use them. I thought I would be out here doing epidemiological studies, and the reality is that I'm not. I'm using the principles, the mathematical principles that I learned in epi and biostatistics, and I'm applying them to different parts of public health. So, for example, if I am working on a deployment dashboard and we need to look at deployers across a number of different tables, well, I'm using Algebra 1 actually to create those formulas, but I'm also using the statistics concepts that I learned to make sure I'm verifying everything that I'm doing. At the same time, I might use formulas or functions that I learned in school, but I'm just applying them in a different context. So for example, if I need a deployer to meet requirements that are found on 5 different tables, I'm using a conditional statement for that. And that is something that I learned in my biostats. I also taught myself a lot of data science. So I would say that I use the foundations of data science a lot. And what I mean by that is understanding data types, understanding what analyses can be done with different data types, understanding data quality, and again, what type of analysis can be done with that data quality, or if I need to go back to my client and tell them that the specific analysis that they want to do may not be available. Let's see what other questions we have on here. I do a lot of, I wouldn't say it's community engagement anymore. I did that when I worked with NGOs internationally. But with data science, I would say I'm doing a lot more of stakeholder engagement and code switching. Socially, we call it code switching. In education, or in data science, we call it programming or coding. With our stakeholder engagement or our client engagement, they don't understand data science the way I understand data science. They haven't spent 6, 7, 8 years studying it. What they do understand is programmatic work. And so a lot of what I have to do is talk to the client about what they want and then translate how that can be accomplished in a mathematical setting, which a lot of times clients think they understand how data works, but in reality, they don't. So that translation piece is really key, because they may say to you, I want to know how many deployers can go to a hantavirus outbreak. That's the business definition of what they want, right? They want to know how many people can they deploy, how many people are ready to go. But the data definition of that, the data science definition, is very different. It's more of a conditional statement that has several arguments, checking several tables. If you're checking several tables before doing that function, you might actually combine everything into one table and then use one function to search multiple columns. So you can see how from the data science perspective, we're using a lot more jargon to answer the questions that come from a business perspective. If I were to reflect on my work in public health, I would say it's probably very similar to a lot of people, which is I went to school thinking that I was preparing myself for A. I came out and there were only jobs available in B. And then from one job to another, I ended up doing C. So as I said, when I first started when I first started public health, I actually came in as a program manager. My background includes field work and learning different languages. But when I graduated, the work that was available to me was more of like an admin assistant job. And in order to do it effectively, you had to be good at data science. And if you weren't good, you had to teach yourself how to do it, because there wasn't a lot of training available. So given that job, I did that job for about a year. And then I did another job that had me work overseas with an NGO. Those two jobs gave me a lot of really good data science experience that helped launched me into the two jobs I had after that, which were very specifically data science jobs. So even though my objective originally coming out of school was to work internationally as a program manager or as a technical advisor, that's just not the jobs that were available when I graduated. So I ended up doing this other work that actually helped launch me into the data science world, which was not something that I had expected to do when I first started my career. If I had had things my way, I probably would have stayed as a program manager. But life happens. I end up learning all these skills. And what I found was that data science actually gave me the, the lifestyle that I wanted. I didn't necessarily want to be sitting at a desk from 8 o'clock in the morning to 5 o'clock in the afternoon. I definitely would have longer hours or shorter hours, and I needed a career that could pivot with that. And it turned out that data science gave me that. So I was able to do one job and a fellowship in data science. And it's put me in the position today where I can do what I'm doing now, which is teaching people data science, and I can make a living doing that. At the same time, I can work, like I said, with either the State Department, federal work, or international NGOs or local NGOs. So even though I came from the social sciences, I am now in the hard sciences, specifically data analysis. And the pathway is not something I expected, but I just kept pivoting with whatever was available, and that's how I ended up where I am. Any advice that I would give students is, first of all, definitely try and learn data science if you can. It's not as hard as people tend to think it is. I thought I was going to have to go in there and learn how to build a computer from scratch. That's not what it is at all. Data science really is just looking at data, cleaning it, transforming it, providing it for people to use it for whatever ends they need. So learn data science because that will give you more privileges in your everyday work. I would also encourage people to develop their emotional intelligence. A lot of people talk about IQ, but in reality, while IQ is important, especially when you're in a setting, academic settings, um, emotional intelligence is also important because a lot of the work that you do, it's teamwork in public health. You're never on your own just doing whatever you want, right? I don't think there's any field like that. But especially in public health, if you're working with the federal government and you're liaising with somebody from the state government, you need to know how to speak their language. Additionally, you need to understand their frustrations with things like data science. I've had customers curse on the phone, not to me, but they were cursing in frustration, right? And so I needed the emotional intelligence to understand that they were frustrated with the process, but that it didn't have any reflection on me personally. And by doing that, I'm able to meet clients where they're at a little bit more easily, I think, than maybe some other people are used to. So yeah, I would push myself to learn new things, especially if it's in data science or it's emotional intelligence. I would also push myself to learn any kind of new productivity tips or study tips. I am surprised by how little I learned how to study in school. It was, even through grad school, it was just a matter of like, we're going to dedicate as many hours as necessary to learn this. There are more productive and efficient ways of studying than how I studied in school. And so it's taken me like 6 years to really dive into it post graduation. I wish I had dove into those things before I even went into graduate school. A lot of my advice is like, make sure you're doing well with the foundations. Not just aiming at getting that fancy job with the big price tag on it, right? But rather building your skills so that you're not left hanging at any point just because the industry has moved on beyond you, right? So in my case, AI did not exist when I first started in public health. I got to teach myself how to do that now. So I'm starting with machine learning, and then I'll, move up to AI. But I'm teaching it to myself, and I'm not paying any money for it. Learning how to do that for myself, I wish I had understood that back when I was in graduate school. So I hope that my information has been helpful. And please reach out if you have any questions or you would like to network or need advice. I am here to help.